very excited. I hope that you find the information important and relevant and inspirational. So I've worked in, other than being critical care nurse, I've worked with dementia patients, spinal cord injury. I've worked in research, telemedicine. Over the last 15 years, I segued into nursing education in different functional roles. Right now, I teach full-time for Paradise Valley Community College. And I teach in Block 1, which is fundamentals, which I love. I get to see the brand new nursing students. And it's very exciting for me. I'm a very kind of a spiritual person by nature. And I've always believed that spirituality is part of being human. And we're going to kind of talk about that today. And I'm always trying to figure out ways to teach my students how to best treat the whole patient, not just their numbers, their labs, their radiology, treating the whole patient. We call that patient-centered care in nursing. So in this, in my talk today, it's going to be some of my stories of how I've addressed and assisted patients with spiritual care needs, how I've collaborated with physicians and providers. And then because I'm an educator, you know, I got to educate about something. So I'm going to be teaching you some things that hopefully that you didn't know. So, okay. So today I have a few objectives. And one of them, which is a little bit Dr. Younger was talking about this, we're going to all kind of work together to try to define spirituality. And we're going to learn why that's a very difficult concept to define, but why it's important. I'm going to talk about nursing and spirituality and what it is to have person-centered care. And then I want to talk about the collaborations. Okay. Okay, so far so good. Okay, good. So, yeah, thank you.
Green laser.
Perfect. Perfect. So I like to intertwine some of my own stories because I feel like that's where your heart comes from, right? I mean, how many of us weren't listening to Dr. Younger, and I felt my eyes get teary. I was going to be like, I need somebody give me the Kleenex, because as a mother, I'm a mother and she's a healthcare provider, and having all of those emotions, it just made her story so much more powerful, doesn't it? It's about that experience. Experiential knowledge. I tell my nursing students this almost every time I have them, that I'm going to teach you the stuff. I'm going to teach you the things that you do, how to take a blood pressure, how to do an assessment, but you don't really fully experience something until you do it, until you actually do it. So how many people here are my healthcare people? Okay, good, perfect. And you know, I was thinking about this before because I was thinking, well, did I make this presentation about healthcare people? But really this is for everyone, because even though I'm a nurse, we may have physicians. Nurse is not just an occupation. It's also, think about what it means to nurse someone. How many people here have ever had a sick friend, a sick family member, where you provided them comfort, where you went to the store and got them some Tylenol, where you went to a hospital and visited someone? So in those terms, we could at any point find ourselves in the position of being someone who is nursing someone. Does that make sense? So what I'm going to teach you, hopefully, are things that you can apply to any situation where you're maybe providing some care, some comfort to another human being. So that's my goal, is that this could be helpful to everybody, not just our nurses, of course, our physicians, our students. So anybody can be a champion for spiritual care. That's my other point. So you don't just have to be a doctor or a nurse or someone in the hospital. So you can be a visitor that's coming in and that sees and identifies a need, and you can make things happen. That's the beauty of it, is making things happen for another person. And you know, it's really simple. People think, oh, it's just so hard and I don't know how to do it. It's really about awareness. And like I said, knowing your resources. And in many cases, it's about the ask. And I'll talk a little bit later about my time in COVID with working with Chaplain Kevin, who I met when I went back to the bedside in 2021, because I felt there was a great need and I wanted to have that experience. There were other reasons, but I really wanted to lay hands on patients, and I didn't know what I was walking into. Did not know what I was walking into. But I will tell you, if I didn't have Chaplain Kevin there every day with me and we were collaborating in this very unique situation, I don't know how things would have gone for me. I really have no idea how things would have gone. So I love this saying. I actually have this in my house. The journey of 1,000 miles begins with a single step. And excuse me, I have to do a little bit of reading. So it's the Lao Tzu. Okay, so 500 BC, Lao Tzu was a Chinese philosopher, and he was credited, I'm going to say he, but he wasn't necessarily a he. He was credited for founding the philosophical system of Taoism. He's best known as the author of the Laozi, later retitled the Tao Ching, which means the way of virtue, or the classic of the way of virtue. And the name by which he's known is not necessarily a personal name. So it's a little bit of nobody really knows if the Tao Lao Tzu was a person or more the name, because it means old man or old master. So was there an individual by that name that ever existed, or was it an amalgam of many different philosophers? We don't know. But his explanation was that people could live happier, more fulfilling lives by aligning themselves with the natural flow of the Tao, instead of placing themselves in opposition to it. And when unheeded, finally he decided, so he eventually left humanity into retirement and began writing of the Tao Te Ching. So I love this. I was born and raised Catholic, and I consider myself a Catholic. I consider myself a Christian, but I'm actually have always been fascinated with all of the world religions, because I could see pieces of myself in so many different religions. And I would meet other people, and I didn't want to ever feel like I wanted to exclude myself from being able to connect with another human because they were this religion or that religion. So for me, one of my first experiences with spiritualism and being a nurse, so I was a brand new nurse, pretty much. So I'm going to say I'm 21 years old, 22 years old. I don't know if you remember when you were 21 or 22. You don't know a whole lot. Okay, you just don't, you haven't had that many years behind you. And they assigned me a patient, and I'll just call her Mrs. Smith, and she was actively dying. Okay, she was actively dying. She was no longer going to be receiving aggressive treatment. She might be dying on my shift. This is all very terrifying for me as a nurse, because I'm used to, going in and smiling and everybody's happy, and I give you your pills and you get better, and then, you go home, right? Isn't that why we're in the hospital? And then I realized, oh dear, some people are going to die, and they might die on my watch. Okay. So that was a bit scary, but I met her daughter, and fortunately they were in a state, she was in a pretty good state of peace about what was happening. But I felt like I didn't know what to do. What am I supposed to do? All the things that I would normally be doing it didn't matter. I'm like, should I check the vitals? They're going, nah. Well, what if she doesn't want to take these pills? She was becoming altered. She couldn't swallow. Well, don't worry about it. I was like, okay, so what do I do? What do I do? And then I realized, watching the daughter and the mother and the daughter, that they were kind of having this sort of a spiritual exchange. The daughter was getting ready to say goodbye to the mother, right? And so I was thinking about all the nursing things, and I was like, what do I do? I'm like, I'm just going to be here. I'm just going to be here. I'm going to be like an extra passenger. I'm going to make sure that the patient is comfortable. If there's something I need to do to make them more comfortable, whether didn't have to be a medication, it could be, turning the patient or providing oral care. And I would tell the daughter, well, these are the things I'm going to do. If I think she seems uncomfortable, because she wasn't really able to speak at this point, then these are things I'm going to do. So we kind of just worked our way through the shift. The patient didn't seem to be in a lot of pain, so I was very grateful for that. Her breathing seemed okay, but you could kind of tell with the breathing that she was sort of slowly, slipping away, if you will. But things went very well. And I just knew that I just had to be there for whatever that meant. And I just was there and checked in with the mother frequently. And I don't remember if I asked her, do you want me to call someone for you? Do you want me to call? This is back in like 1992. So I'm not sure what the state of was with having spiritual care or pastoral care available. I'm not really sure. But I remember how powerful it was. So this was in San Diego, where I was working in a hospital overlooking the ocean. I remember this. I remember it like it was yesterday. So I remember the sun started to set. We had beautiful sunsets. Beautiful. The sun is setting over the ocean. and the patient takes her last breath. Right at the end of my shift. And for some reason, that just to me was like, oh my gosh, this is what it was supposed to be. And it was beautiful. There was something really beautiful. I'm like, oh, Joanne, you chose to leave right at this beautiful moment, and you left and you went with the sunset, and it just really touched my heart. And then I realized, you know what, maybe I shouldn't be afraid. Maybe there's an opportunity for me here as a nurse to provide more than just what we consider basic nursing care. But I remember it touched my heart, and I'll always remember that. You know, I don't remember the room number, but I remember exactly where that room was. And, you know, so there are things that just stay with you. So what I'd like to do, we talk about spirituality. Dr. Younger mentioned it a little bit. It's actually a little bit of an elusive concept. So I want to do something called a clustering exercise. So I'm going to pass out a piece of paper to everybody. Oh, thank you, Michael. We're going to take a piece of paper. Yes, I'm an educator. I am going to make you actually. So sorry. I'm going to make you work. Okay, take a piece of paper and I'm going to pass out some markers. I actually think this is small enough for. So I want everybody to take 2 markers, 2 different colors. And there's a method to my it's hard to believe it, but so take, I think I'm enough for everybody to take 2, and then we'll just kind of, and you can. Yeah, sure. Okay. That was not a great attempt, truly, at that picture. Does everybody maybe have 2 markers? Okay. I don't, but you know, it's okay if you don't have to. I was gonna delineate the colors. The colors were gonna mean something, but we can make this work. You know what? In nursing, we make things work even when we don't have. That's right. Okay, so what I would like you to do in the center of your paper is write the word spirituality, like I have it here, and circle it. Then I want you to think about what it means to you. And then I want you to think about the terms that you relate to spirituality, and maybe you write a term here, and then if it's really important, you have a really emboldened line to it, or maybe it's something not quite as important, but it relates, maybe you have dotted lines. So I want you to take a few minutes and think about what it means to you. Because we're going to discuss some other things, but I want to see, I think everybody kind of has their own perception of what it is. Is there something that you think it's not? You could write a line and ask them. You're like a spirituality definitely is this. Have 2 colors. Use 1 color for this part of the exercise. So I began doing some of my own research, of course, into the word spirituality. Since I talk about it a lot and I talk about how important it is, I thought, what am I talking about? What am I talking about? So I love some of these ideas. What I'd like you to do with your other color of marker, is there something on here that you identified that's similar? So did you say something that is more than religion? Is it something that's inspirational? Does it help you connect with God? So if you found things on your own paper, then use the other pen and kind of circle it. So you can kind of see where there might be similarities. Is it a belief or a value system? that permeates your life? Is it the way in which a person understands life in view of its ultimate meaning? So did you come up with any of these ideas, is my question to you? So there's really no universal definition of spirituality. I found a lot of great ones. And one of the major reasons behind that is each person's conception of what spirituality means to him or her is unique. And that's frequently reported in nursing literature. It's important to remember when working with clients, maybe I'll call them clients, maybe I'll call them patients, it's the client's view of his or own personal spirituality that's important if nurses are committed to what we call in nursing client-centered care. We also call it a person-centered approach. So it's a key. That is a key to ensuring that the patient's spirituality is understood from his or her perspective. So here's some other ideas. Spirituality is in the way in which a person understands and lives life in view of their own ultimate meaning, what life means to them, their beliefs, their values. It's a unifying and integrative aspect of a person's life. And when lived intentionally, I like this, it's experienced as a process of growth and maturity. I like this one too. The fundamental basis for the individual's relationship with others and with society. It includes a sense of transcendence and is the interpretive lens through which the person sees the world. So what you'll notice is none of these definitions say, if you're Catholic, you're spiritual. If you're a Christian, you're spiritual. If you're a Mormon, you're spiritual, right? So how many people do we know in our own lives? I like to think about this. So I grew up as a Catholic. And we went to church every Sunday. Okay, that was required. You go to church every Sunday. But other than that, there wasn't a whole lot of faith sort of going on behind the scenes. Does that make sense? In fact, there were a lot of things that were probably very anti-Christian and anti-Catholic going on in my own life, in my own home. So that for me, and this is why probably some people feel that religion can fail us, or we may feel failed by religion. So are you just doing the steps, or are you living the life? Or have you ever met anyone in your life? I have met some of the most spiritual people who absolutely did not identify with the religion at all. But they were the most spiritual people. They were people living their lives based on, I'm like, clearly you have rules, you have ethics, you have values. But yet you're not associated with a specific religion. And I always found that interesting. I found that very interesting. Oh, can you guys see that? That color? Yeah. I guess you can't see it if I stand in front of it either. That's probably not good. Okay, so varies between individuals. So it's a basic and inherent quality of all humans. It's integrating creative energy. This is Haas, Albert Haas, who was a well-known figure in Christian spirituality. He was a Franciscan priest, a preacher, a teacher, and spiritual director. And he's authored several books and presented numerous videos on spirituality. So I really enjoyed him because he's actually traveled around the world exploring different religions as well, which I really appreciated that. So there was something I had right on my mind and now I'm not remembering it. Okay. So once again, spirituality, this really huge term that means a lot. And some of my favorite things that I read about it. Having a connection with others, nature, or a supreme being, which may or may not involve with a religious structure or traditions. Most of us as humans, okay, I would say, want to find meaning in their life. Right? How many people haven't thought, well, why am I here? Why are any of us here? And often when I think about, we were listening to Bishop Dolan's story about his family members, 3 family members who had committed suicide. And I just think about that pain and I think about, wow, were they asking those questions, right? Was any part of, and he was talking about, of course, mental health and mental illness, which is real, but how many people feel like, what's the point? What's the purpose? Why am I here? And that's part of what spirituality, right, can bring to us is that sense of purpose, that sense of connection. So talking a little bit about nursing, because I am a nurse, I have to talk about nursing. So there's a common sort of a general knowledge in nursing literature that spirituality is part of being human. So that means that all beings are spiritual beings, whether they're aware of it or not. And I'll share this with you. This is on a personal level. So my dad was dying and he was at home on hospice. And I don't remember the exact words, but I said something like, "It's okay, Dad, you're gonna go, I don't know, you're gonna go be with God, or you're gonna be with something." I don't remember exactly what I said, but he said something along the lines of, "I wasn't a believer. I didn't believe." And I just instinctively said, "Dad, it's okay. You didn't believe, but he believed in you. He believed in you." I don't know why I said that, because I think he was telling me I'm not worthy. I'm not going to heaven. I never really believed. I was a hypocrite, right? There were a lot of hypocritical things going on in my own house, but I was like, it's okay, because he believes in you, because there was goodness in you and there is goodness in you. And sometimes our lives do not align. We don't get aligned in life to have some great, wonderful, magical, spiritual, or religious experience, right? And this is, when I was young, I started to think, because I did have friends and I had people that were very strict in their faith in Christianity, and they would say, you know what, if you don't accept Jesus as your savior, you're going to hell. I remember that. And I was like, wait a minute, but what about all the little kids in Africa? What about the people who've never met Christ? Are they going to hell? Is that really right? And is that really fair if someone's never had an exposure that this is going to happen? So as you can see, where I was very much kind of doubting the kind of what was being fed to me in some ways. Does that make sense? And I do respect that people have their religions and their beliefs, and everybody, in your mind, I guess if you want to believe I have to do these things and be worthy, that's what you're going to believe. But I just didn't believe that God was going to do that for little children. Like I knew, no, I don't think that's right. I don't think that's going to happen. So by virtue of being human, all persons at all ages and all cultures, whether or not they're religious, are bio-psycho-social spiritual beings. That's actually one word, bio-psycho-social spiritual beings. Burgard and the guy Jackson stated, rather than separate parts, the body, mind, spirit is in essence an intertwined and interpenetrating unity. So a close connection between spirituality and personhood, by maintaining that spiritual is being fully human and that being fully human is being spiritual. So you can say, listen, I have people say, I don't believe in God, I don't believe anything. Well, I go, what do you think happens when you die? Nothing. When you die, you're dead. Oh, okay. So I would always love to explore, well, why do you even think we're here? Like, why do you think there's a greater meaning to this? No, there's no greater meaning to it. We're just here, and then when we're not here, we're gone. I'm like, well, I like to explore those comments to see what else, because I find it hard to believe that a person, do we not all have goals in life? How do you see your life? Where do you see yourselves in 5 years? How do you want to be remembered? What do you want to be known for? I think everybody has some idea of what they think their life can or should look like, right? I think everybody does. And I always bring it to nurses' attention when we talk about mental health, and we haven't really talked about it here, but addiction. We're in a big mental health crisis in this country. We have a huge crisis of addiction. I mean, can I tell you how many patients I took care of that were fentanyl overdoses? Can I tell you how many patients I took care of that were alcoholics going to alcohol withdrawal? I mean, that's a big part of being in the healthcare setting. I'm having to train my nursing students about what's the clientele going to look like. And it looks different than it did 30 years ago, because we're in a mental health crisis. Okay, and we have addiction crises. But once again, we're all still human, and sometimes you get kind of judgy, okay, in healthcare. I'm going to talk to my healthcare people, right? Have somebody come in, I'm just going to call him Randall. You know what no he is. Randall comes in, and he's a guy who's been homeless for 2 years, and he comes in with a cellulitis, and he's swearing at everybody, and he tells you, I need this and I need that, and that person stole my cookie and that person took my pudding, and
You know, he's screaming at the staff and kicking people out of his room, and I'm like, all right, Mari, you gotta pray. First of all, you gotta pray. We have to pray before we're working with Randall, okay? Bring myself to a centered place. And then the staff, is they're all sick of him. They're like, who's taking Randall today? Who's taking him? Well, I took him yesterday. Well, I took him the day before yesterday. So I just tell them, listen, guys, remember one thing. Everybody was once a cute little baby or a cute little 5-year-old. Nobody ever said to a 5-year-old, what do you want to be when you grow up? I want to be a drug addicted, meth infested, homeless guy. That's what I want to be. I want to be an alcoholic. How do these things happen? They do happen though, right? And they happen to our loved ones. They happen to people that we know. So we are all, I was kind of think we're all fallible, and we all could just be one step away from disaster. How many people have you known in your life, and their life started out good, maybe things look pretty good, maybe they got married, maybe they had a couple kids, things look good. Then something happened to the brain. I don't know what happened. This is a true story of a friend, an acquaintance. Had a great story, had a great life, had a beautiful wife, beautiful children, business. You couldn't want anything more, could you? Well, guess what? He hurt his back. He hurt his back doing construction work, and guess what that led to? Narcotic use. And then he couldn't get the narcotics anymore because physicians are told you cannot overprescribe narcotics because we have a narcotic problem in this country. So now guess what? You don't get your narcotics. Guess what you're going to do? You're in pain. You're going to get whatever you can get. So maybe you're going to overdrink, you're going to get street drugs. So anyways, fast forward, this man became an addict, and he lost his job, he lost his wife, he lost his children, he lost his house. He lost everything. But I would say, in dealing with those kinds of people, I always try to come at them as one spiritual being to another spiritual being, because they're in pain, right? You don't get like that for no reason. You're in pain. And so we have to remember, and that's what I try to teach my students. So the goal of nursing, let me flip back to nursing, is to provide holistic care, to provide this care for all, regardless of whether a nurse is able to converse with clients about spirituality or not. If people are spiritual simply because they are human, then those limited by cognitive ability, those with dementia, those who are in a comatose state, are still spiritual beings. So here's another story, one of my favorite stories. I was working in Virginia in the ICU, and I was going to take care of a patient, a young lady, probably 20, 21 years old. She had something called PCP pneumonia, which is from, she was HIV positive, which had turned into full-blown an AIDS crisis. And she was in a very bad way. Both of her lungs had collapsed. Okay, she had chest tubes coming out of either side. She was on a ventilator. So when you're on a ventilator, you can't speak. Okay, you cannot really communicate with another person. So she was lying in that bed, and I remember that she would put her call light on a lot. And the nurses that I worked with, and unfortunately, the place I worked, things were not great there. Let me just say things were not great there. There was a cultural perspective that if you were HIV positive and got AIDS, you did that to yourself. You caused this to yourself, so you don't deserve compassion. I had never been exposed to some of these cultural beliefs, and I was, for myself, kind of put it back because nobody really wanted to deal with them. And the physician refused to give me medications for her. In fact, he screamed. He screamed at her from the nursing station. I'll never forget it. I will never forget it. He goes, excuse me, Dr. Dennis, and I don't care, I'll use the same. Excuse me, Dr. Dennis, could we get some Ativan for Mrs. Whatever? And he went like this. He took his pen, he goes, you want some G-damn Ativan? You're not getting any G-damn Ativan. He screaming it down the hallway towards the patient. I just kind of went, okay, I guess we're not going to give her any Ativan. And I was like, I don't know. I stepped into the twilight zone. But I had to do something. So anyways, she was very anxious, and I walked into her room, and she had, and I'll talk about cues. In one hand, she had a rosary, and in another hand, she had a tiny Bible, and she was clutching them. She was clutching those two items like her life depended on it. And I just remember going in and saying, you know, hi Denise, it's Mari, I'm going to take care of you. And You know, I remember she was so anxious, sat down, I just put the side rail down, I brought my charting in the room. Thankfully, it was paper charting, so I sat down and I just started to stroke her arm. That's all I did. I go, you're gonna be okay. I started to stroke her arm and I watched her on the monitor because her heart rate was like 120. And slowly her heart rate starts to go down. Oh, look at that, it's 110. Oh my gosh, look at that, it's 100. She was calming down. And I just was literally stroking her. And then I said, well, I see, and she couldn't talk to me. And I said, I see you're holding your little Bible. I go, you know what? I just started talking to her. Said, I really love the passages in John. Can I read some to you? Can I read some to you? So I just took the Bible and I started to read to her. You know, and we just had kind of this beautiful connection. And probably for the first time in many days, this young girl who was dying, hopefully felt some peace that someone was there and cared about her. And so I did that for a while, and, you know, I was so proud of myself. I was like, gosh, darn it, I'm just so good. You know, in my mind, I'm not saying that to anyone, because that would not go well among my peers. See how good I am. I'm just so awesome. Well, you know, really, I was so proud of myself. I'll never forget going to that nursing station and having somebody look at me and go, well, thanks that you did that. Now she's gonna think we're all gonna sit in there with her. And I looked at that nurse and she was big and she was mean. I mean, I'm not small, but she was big. And she was mean. And I looked up at her and her name was Minnie. I'm not making this up. She goes, well, thanks a lot. Now she's gonna think we're all gonna do it. I looked up at Minnie and I go, no, Minnie, I don't think she's gonna think that at all. I was like, come on, Minnie, bring it. Anyways, bring it, Minnie, just bring it right now. Because I was like, what? Minnie she was scared. This was a scare. Bring it, Minnie, just bring it right now. Because one thing you will never, ever get out of me if I'm doing the right for my patient. I'm like, that's fine. You can bully me. You can steal my jacket out of the break room. I know you took my Chick-fil-A the other day. It's okay. I know y'all hate my guts. But I'm actually not here for you. I'm here for the patients.
Yeah.
I'm here for the patients. So I'll just never forget people being mad at me because I just thought it was really great what I did. Sadly, the next time I came in, I go, what happened to, I'll call her Denise. She died. They were trying to put her on a gurney. They were going to take her for a CAT scan or something and she died. So that was very sad. But once again, I learned a lot working in that small hospital in Virginia, which was shrouded in its own, let's say, political, cultural belief system, which I was not familiar with, right? I was the outsider. I was from San Diego. Hi, I'm Brittany. I'm going to be your nurse. Blonde hair. Nobody else in that whole place had blonde hair, so of course I hated it. I was a hateable character in that setting, right? Hi, how are you? Anyways, yeah, it was a very stressful, terrible job. And every day I left that job and I cried. I drove in my car and I cried, oh, terrible. And I went home and told my husband, this place is terrible. You got to see these nurses. And I go, and then the doctors, he goes, well, you don't have to work there. You just quit. No, I can't quit. Patients need me. They need me. You know, I just was such a, yeah. He just kind of looked at me and goes, okay, well, if you need to quit, you can quit. And I go, no, I can't. Because I really took on this role of I'm the savior in the terrible hospital run by Minnie Mouse. Okay. And Dr. Dennis, like now I have to go in and I have to protect these poor patients. See my savior complex? You see how that worked out for me? Anyways. But I was really proud of being able to sort of come up with that solution. Does that make sense? Really not knowing how to help this patient. And then, like I said, watching her heartbeat, just watching it go down and just realizing she just needed someone to be in here with her and she just needed to be comforted. And, you know, and just feeling that sense of sadness that even her own, you know, her own family had sort of, they wrote her off. The medical community wrote her off. They're like, you did this to yourself. You did this to yourself. So I really had to educate myself actually a lot about some of the cultural differences so that I could be better informed and understand and figure out how to cross some of those barriers, right, in that community. So for those of us who work in different, if you go to a different community, this is important as healthcare providers. Every community has culture, okay? So like I said, not everybody's like, hey, I'm Marnie, I'm gonna be your nurse. I'm so happy. I mean, I went from Scripps Clinic in San Diego, which was like world-renowned care, world-renowned care, and then I went to other places that I'm like, well, this is different. This is where I'm not in Kansas anymore. I'm 100% not in Kansas. I don't even know if I'm on this planet anymore. But, so kind of blending in culture. So nursing process, you guys. So what is that? So we teach our nursing students early on that to be a good nurse, it's not just about knowing stuff. How to check a blood pressure, great, you know how to do that. How to perform an assessment, how to give a medication, that's all well and good, but you have to learn how to think like a nurse. Okay, and there's a whole process. And it's based around critical thinking, which is not a nursing or a medical thing. I don't know if our medical students learn like a thinking, do they, Dr. Younger? How to think like a doctor, how to think like a nurse. So the first thing, and I won't go through Kathy Lassiter, even though she's kind of my hero, is what you notice. So the first thing in any situation is noticing. Noticing, and what we call cue perception or cue recognition. So what I did way back in the day, this is even before Kathy Lassiter got her stuff published. So I was doing Kathy Lassiter before Kathy Lassiter knew she was Kathy Lassiter. No, I don't know if she would agree with that. I'll have to send her an email. Say, just want you to know, I was thinking about your stuff before you were thinking about it. Anyways, so I noticed that the patient was holding these two things. I noticed it. And what did I do with that? Did I take that information and discard it? Did I just take that information and go, whatever, I gotta give my meds, right? I gotta do my checklist. So medicine and nursing, and it's so many algorithms and checklists. And did you document this? Did you document this? Did you click it's all about clicking the boxes and pushing a computer around the hallways. When I was at COVID, you know, it was funny and strange. We're all walking around the unit and we all have our own computer. Like something terrible is going to happen if I'm not in front of this computer, the world might end. And we're all running into each other, excuse me, excuse me. You know, and I thought, this is not a way to nurse. I go, no, I reject this. I mentally reject this. So what did I do? I said, my first hour with my patients, I'm not having a computer. I'm walking in just like this, just bare naked. Not bare naked, but no computer. And I'm going to introduce myself. Not bare naked, because that would be a great for another story. But not today's story. But I'm like, I want to walk in and meet them. And I'm going to sit down for 5 minutes. How are you, Mrs. Smith? I'm Mari. I'm going to be your nurse today. Tell me about your day. How was your day? Oh, it was horrible. It's terrible. I had the worst, you know. The doctor did this and I haven't eaten in 12 hours and nobody told me the results of my cats, you know. Oh my gosh, do you have concerns? We're going to address all those concerns. Let's see what. Really go in and I say 15 minutes per patient that I meet them and I introduce myself without my computer. And people are like, are you nuts? Are you nuts? But where are you going to look up the things, the labs, and the things? You're not going to know the things. So I'm going to know everything I need to know. Okay. But this is how I want to meet a person. I want to meet them as a human. Because let me tell you what, if you start treating people like they're another number, how much do we love it when you walk in? Anybody been a patient at all? Okay. Did they, please tell me if I'm wrong, did they not push the thing in? Or with the computer in the room? And here they are. Clicking. Hi, how are you? Hi. So they're looking at their computer, they're clicking your computer. Okay, I need to do your history now. Okay, do you smoke? Do you drink? Where do you live? Do you have stairs? It's just so, they don't look at you. They don't look at you because they're so focused on, I gotta get the thing in the computer, because then the system, the people tell you, well, if you didn't sharp it, you didn't do it. Okay, that's legal. Legal and HR. Can you tell that I'm not a fan of legal and HR people? Yeah, we all like, I don't do very well. That's why I never really made my way up the ladder in nursing leadership, because I don't drink that kind of Kool-Aid. I drink my own Kool-Aid and I get in trouble. I make my own Kool-Aid, okay? I have my own Kool-Aid and I like it. It makes me very happy. Okay. I am digressing a bit on what. Let's see, okay. And I was supposed to be talking about nursing process, and I don't know where I ended. Somebody tell me where I ended. So I guess my point is noticing skills, cue perception. One thing I do with my block 1 nursing students, one activity, and someone gave me this idea. I loved it. Tell my students, you're going to go in a room, okay? You're not writing anything down. You're going to go in a room for 5 minutes. You're going to go in the room for 5 minutes. What you do in there is up to you. Do you want to assess your patient? you wanna look at their ID site? What do you wanna do? You're gonna stay 5 minutes in there, I want you to come out. And you write down 5 things you noticed. And it can be about the patient, it can be about the room, it can be about a family member, it can be about anything. So at the end of our day, we do post-conference and there's, right? And I say, okay, today was noticing day. Okay, Jan, what did you notice? Well, I noticed that the floor was dirty. Okay, good. What else did you notice? And then the side rail was this, and then the patient's hair looked bad. I mean, anything you wanna look at, right? What did you notice about the room? And I said, you know what? Then somebody else says, well, I noticed that the IV machine was doing this. And so I go, you know what? What do you think about the fact that they focused on this? This is where their eyes went. They went to look for something. And as an ICU nurse, when I walk in a room, I am looking right at the patient, but I know I gotta look at those pumps. I know I gotta look at the IV sites, make sure nothing's infiltrated because it's safety. So I'm like, if I taught you about all the safety things, would you walk into that room differently? Would you purposely try to look at things or notice things? Because here's what I found in our world with our students now. Oh, I didn't need that. So students are very much, I shouldn't even just say students, I said people. Do you guys notice how people don't notice anything anymore? Do you ever notice that? Is it just me? Okay, this drives me crazy. But you're in Albertson's parking lot. Okay, you're driving at a reasonable speed. Do you notice all the people come out of the store with their carts and they walk right in front? They don't look. There's no looking. And I'm like, I have a 5,000-pound machine. What if I didn't see you? I could run you right over, but people aren't noticing. They're just, oh no, it's just about me and everything's about me and my world. And I'm just gonna walk out there because they have to stop because it's the law, Michael. It's the law that they stop with me. You know, every now and then, you know, people, maybe they don't follow the law. And maybe I'm hyper vigilant because I've been a nurse for so long, but I will tell you what, whenever something doesn't have a smell, doesn't like hit the smell test, like, I don't know if it's a little bit of paranoia, a little bit of OCD, it's probably a blending. I probably have all of these things. I compacted into one delightful personality, but maybe not always delightful. So I remember going to the grocery store with my daughters when they were young, and there was a guy in front of the grocery store. And he's walking in. You know, he's talking to somebody, nobody's there, but he's swearing and he's angry. He's going back and forth. And I went, mental health concern, mental health breakdown. And I go, ladies, we're not going in to get the ice cream. Why not? I go, I want to show you something. See this gentleman? God bless his heart. We're going to pray for him, but he is not well. And so we're not going to go with my daughters. We're not going to expose ourselves. We're not going to ignore him. I said, he is not well. And if he's still there in a few minutes, I'll probably call the police because he's having a mental health breakdown. Or maybe he's on drugs, but he's very angry. And so what's going to stop him from whipping his head around and seeing me and going, you stole my pudding, and beating me up? Now, if I were just by myself, I might have taken that chance because I am kind of a risk taker by nature, but I had my young children and I was like, that's not acceptable. It is not acceptable to put them at risk. But the funny thing was, to me, is everybody just walked by him. Kind of like, well, he's not here. I'm like, but he is there. And I'm like, why is nobody noticing? Or seeming to notice, or maybe people notice and they just put it in the back pocket. Okay, well, he's having problems. What happened to, I always go back to Jesus. What would Jesus do? I do. I know it sounds really cliche, doesn't it? What would Jesus do? Would you ask? Can I help you? I think this story is funny, I'm gonna share. So I know, because it's about noticing. So I was driving down the street one day and I noticed a woman with a suitcase. It was very hot. She looked like maybe she was someone from out of town, and she's pulling a suitcase. There was something about me that just made me think, she has nowhere to go. Is she homeless? She has no money. I don't know what was happening. I go, you know what? I need to give her some money. I'm gonna help her out a little bit. I don't know if she needs a taxi. I don't want her in my car. So I literally drove to the bank. I got out $40 or $60, I think, out of the bank. And then I turned around, I said, if she's still walking down Brown Avenue, I'm pulling over. I'm gonna do something good today, you know? So I pulled over and I go, excuse me, ma'am. I go, hi, you know, I just wanted to see if I could help you, you know? Would you like, you know, would you like to take this? And then she came up to me. I just love this story. She took the money and she looks at it and she goes, well, that ain't gonna be enough. It was part of me that literally For half of a second, I thought, well, I'll go back to the bank and get some more. And I go, what? That's not enough, ma'am. I'm giving you $60. You didn't even ask for the money. And you're telling me it's not enough. Not enough for what? And I just remember thinking, you know what? Okay, I'm not gonna let that change my. I can't know what is in someone's heart or what their expectations are. And I think I just said, well, that's all I got. So good luck. But it was just funny because once again, my savior complex. Look at me. Look how great I am. I'm gonna give this money to this person. They're gonna be, oh, thank you so much. Thank you, ma'am. Thank you. You're so kind. And I got, that ain't gonna. I'm like, well, yeah, you're probably right. It's probably not gonna get you a room for the night, but you know, do what you will. Do what you will. So basically my point is noticing the world around you. Okay, this is gonna be fun. All right, guys. So here's what we're gonna do. Here's what we're gonna do. We're gonna see what kind of knowledge we have, or what kind of knowledge we don't have. I made these little packets. And they have symbols. They have symbols in them. So what I'd like you to do is take a look, maybe pair up with somebody, and see if you know what these symbols are, or you know what they represent. Because once again, we live in a world where we have many different types of ways to be spiritual. So I want you guys to take these out and get with somebody. And I want you to take them out and see what you know. What you know, we're gonna share. And I want you to keep these. Take them out. And see what we know. If you want to look at your phone, I'll give you a few minutes. If you want to see if you can't figure out what it is, we'll see what Jessica in your phone.
Okay, yeah. That's what I'm.
Okay. Okay. So. Let's see what you guys came up with. Well, what was probably maybe the easiest one for all of us? This one across. Christianity. Yes. So I pulled up some interesting facts. Christianity as of 2024. There are approximately 2.6 billion Christians worldwide, making it the largest religion, and it represents about 1/3 of the global population. So it's spread across many different denominations and regions, with significant growth in Africa, Latin America in recent years. And then it's interesting because Europe, which was traditionally Christian, has had a little bit of a decline. So I thought that was interesting. So the cross, it holds, we all probably know, profound significance as the central symbol of the Christian faith. And it represents the crucifixion and resurrection of Christ. So key aspects of the meaning. What do you think? What do you think it means? The cross. What else does it mean?
Salvation.
Salvation. Yes. Any other word come to mind?
The gateway to heaven.
The gateway to heaven. Redemption. That's right here. Sacrifice and redemption. It's seen as a place where Jesus offered himself as a sacrifice to atone for humanity's sins. And according to Christian beliefs, Jesus' death on the cross restored the broken relationship between humanity and God. So it's a symbol, right? A symbol of God's love. A victory over sin and death. Christians believe that Jesus' resurrection following his death on the cross demonstrates his victory over sin, death, and evil. What's the other, can anybody think of another symbol other than the cross that represents Christianity?
Fish.
The fish. He gets an A+. You are a star student. And most of my star students sit in the front. So I like that you're in the back. You're mixing it up. You're mixing it up.
Pastor well.
Very good. An early Christian symbol often used to identify believers. Okay, so this one is a little bit, how about this one up here? It's called the crescent and the star. Islam, Muslim, right. So it's often associated with Islam. There are 1.5 million people who practice the Islamic faith in the US, and it says here about 1.5 billion in the world. So why is it a crescent and a star? It symbolizes a strict lunar calendar, which consists of 12 months, lasting 29 days or 30 days each, depending on the actual sighting of the new moon at the outset of each month. So I didn't know that. with no adjustment made to remain consistent with the solar calendar. So here we've got, as of 2024, on my latest statistics, there are approximately 2 billion Muslims worldwide. Islam is the second largest religion globally. It continues to grow due to factors such as higher birth rates in Muslim majority regions and increased migration. And projections that by 2050, Islam may nearly match Christianity in terms of the number of adherents. And some predict it might even be, could become the largest world religion by 2070 or 2100. So crescent and star. Okay. What about the 5 pointed star? Judaism. Yes, so as of 2023, it's where I got my statistics. The global Jewish population is about 15.7 million, which is about 0.2% of the total world's population, and about 7.2 million Jews live in Israel. About 6.3 live in the United States. And there are other significant communities in France, Canada, United Kingdom, Argentina, and that is the Star of David, or also known as the Magen David, and it represents divine protection. So it's a symbol of Jewish identity, protection. Shield of David is another term that's referred to. And it's also spiritually, the star is interpreted as a symbol of relationship between God and humanity, with 2 interlocking triangles symbolizing the connection between the divine and the earthly. And some see it as representation of a balance between opposites like heaven and earth. And then how about this one? Giants. Well, that's good. That's good. So this is a little bit more difficult because this is called, well, it's called a Hamsa hand. It's a rare symbol that makes appearance in all the worlds. It can make the appearance in many religions, including Hinduism, Buddhism, Judaism, Christianity, and Islam. And each one of the religions adopted the Hamsa and gave it their own interpretation. So it's dating back thousands of years. It may have originated in Mesopotamia and Carthage, where it was used as an amulet to repel the evil eye, a concept that existed in a wide range of cultures. Anybody else know anything else about the Hamsa hand?
Depending on which hand, I mean, research I just did, you can wear it on your left, you're giving away your, or sharing positive energy.
Okay.
If you wear it on your right, you're getting rid of the negative energy.
Wow. So, you know, just in the time that I spent sort of exploring symbolism, and the reason why I bring that up when I talk about cue recognition is working with patients, I always try to be very mindful of, are they wearing jewelry? Is there something they have with them at the bedside that can cue me in? Hey, you know what, they're really, you know, there's spiritual, there's a spiritual relationship here. And so usually what I'll do with that, and you're like, what do you do with that? I ask questions. Tell me about this. Oh, is that, so now I know it's a Hamsa hand. Oh, you know what, is that a Hamsa hand? Is that a whatever, is that a Star of David? Oh, are you know, and opening up that conversation like we were talking about earlier with Dr. Tina, opening up that conversation, being aware, because people, symbols, you know, people wear symbols, right? So we know who our Christians are wearing our crosses, but because there are so many different religions that I like to just sort of have this increased awareness that these items can mean something. They can mean something to different people. And that's a great gateway into asking them more about their spiritual beliefs or their spiritual needs, is asking about what it is and what it represents to them. One of my COVID stories, when I went back to the bedside with COVID, working in East Mesa. So we have a lot of, right in Arizona, we have a significant Native American population. And with them, I think sometimes some of their cultural beliefs are difficult to maybe come by, because I know some of their beliefs and their religions protect it, right? They protect it, and it's not something I could just go on the internet and go, I want to find out about this particular tribe's beliefs. So they protect their belief systems for, you know, of course, many different reasons. But I remember taking care of a man. He was probably 35-ish years old. So during COVID, in the hospitals, people couldn't have visitors. Okay, so we have people coming into the hospital that are very, very sick. They're not allowed to have anyone at the bedside. They're placed in isolation. So the only way they're seeing you, right, is with all of your garb, your gown, your mask, your N95 mask. So, you know, there's already this sort of barrier between you and a patient, but I'll never forget him because I knew that he was Native, and he had a wife and he had a family, and he had been a veteran, and he was very, very sick. And I remember him holding on to something. I don't remember exactly what it was, but his wife would call every day. She couldn't come in, and we had to transfer him to the ICU, and we all kind of knew this is not going to end well. And we did have to put him on a ventilator. And I remember thinking, I don't know what to do for him. He was so scared. I'll never forget that. I just never forget the fear, the total fear in people's faces. But I do remember that his wife would call every night, and usually I was in charge, so she would call, and she was just beside herself. She was beside herself, and she would just be crying, and she just would be talking. And so rather than be like, listen, I don't have time for any of that, you know, I don't have time for this, let me get someone in spiritual care to talk to you or whatever, I would just stay on the phone with her for as long as she needed. Okay, I wasn't gonna be the one to stop the conversation. I will call him Travis. So I just remember she would call and say, how's Travis doing? And go, well, this is where we are, this is what is oxygenating, all the medical stuff. And she would say, can you please go in the room and pull the curtains? Because I don't want the spirits to come get him. So I didn't realize that. So that was their belief system. If the spirits could see him, that he was getting ready to pass, they would come and get him. And so every night I would say, I'm gonna put you on hold and I'll go do it. I'd put her on hold, I'd go into the room, everybody's looking at me like I'm nuts. What are you doing with the blinds? And the blinds were broken, of course. And I go, I gotta fix these stupid blinds because the spirits are gonna come get him. He's like, and then they thought I was losing my mind. I go, it's a thing, okay? It's a thing. Don't be so judgy. So I'd go and close the blinds, I'd come out, and I would say, okay, the blinds are closed. You should be like, okay, good. And I would just let her sort of talk about whatever she wants to talk about. You know, people would be like, call on line 7, patient in room 2 is gonna code. And I'm just like, oh, talk to somebody else. Like, she needs me. She needs me. And I let her say whatever she wanted to say, you know, and, you know, she would just cry. And, you know, he's a veteran. Why can't we get him on the ECMO? She was asking about ECMO. ECMO is a highly specific labor-intensive treatment when people's lungs don't work, and everybody who had COVID in the ICU probably could have used ECMO, and there aren't enough resources. So you're only going to get ECMO if you're at the Mayo Clinic or you're at St. Joe's. So very few people were going to get this treatment. I know for sure he wasn't going to get it because at this time people weren't transferring patients out. If you had a patient, you had a hospital full of COVID patients, which we did, and you wanted to transfer your patient out because he was going to die if he didn't get out, it was too bad. Everybody else is going to die too. So that was really difficult because I was like, what do I say to this woman? She's doing her research. She's asking for ECMO. You know, what do I say? Very terrible situation. But I do remember that I was like, well, maybe there's not as much I can do for him, but I can do for her. I can maybe do for her. And I do remember the last night that he was really starting to go, and I was like, he's not going to make it through the night. And we had the hospital said, okay, well, if someone's dying now at COVID, to have context of this, it's like half my patients in the hospital were dying. But are you really dying? Are you sort of dying? Are you partially dying? Are you at a 90% dying? Okay. Because almost all my patients were dying. And I go, well, what do you want me to do? But I was like, I don't think this will make it through the night. Can she come in, Danielle? Let her come in, say goodbye to her husband. I remember I had to make that phone call. I had to make the phone call and I'd say, I think you should come in. And then I think she knew what that meant. She knew what that meant. You got to come in. And I was kind of glad I wasn't there for his passing because I know that would have been, I would have had to go to the bathroom for a few minutes and bawl my eyes out and then come back. because there's other, you know, we had more patients. We had patients on the telemetry side that should have been ICU. We had patients all over the hospital that needed higher level of care, and we just didn't have it to give. And so that kind of brings me around to COVID. So this is really kind of where I found my faith was tested at another level, you know, as someone in the medical field. I had never worked with a pandemic. The closest thing that I was exposed to was AIDS. In the 90s, AIDS was still a very scary thing. And people were still like, well, if I touch a patient, am I going to get AIDS? We had a whole AIDS floor at UCSD Medical Center. It was the 7th floor. And I was a patient care, I was a CNA, and I'd be like, well, I'm floating up to the 8th floor. I mean, you weren't supposed to call it that. I'm floating to the 8th floor, but that's the floor. Everybody got on the same floor. And it was kind of like COVID, because if you were that sick and you had AIDS and you got PCP pneumonia, you were probably going to die. So the COVID was unlike anything that anybody had ever seen. So I would come to get to know and have this great relationship with Chaplain Kevin, and I will talk about him. So I loved sort of looking into, I was talking to patients after they've been critically ill, if I'm never able to see them again and meet them and ask them about their experience. So I realized my body was almost dead, but my spirit was alive and well. And I had no interest whatsoever in all the voices and activity that had surrounded me for those 10 days. However, my spirit responded when something of spiritual significance was happening. I remember every detail of these experiences. So the other thing that can happen to us in healthcare, and I'm an ICU nurse, is we got our patients, and you know what? This is a pretty accurate rendition. It's a patient who's on a ventilator, he's sedated, he can't really talk to you. You have medications keeping these people alive, but it does sort of dehumanize that person in the bed. Okay, it dehumanizes them. And some of my most salty ICU colleagues will say, I like my patients on a ventilator and sedated, you know, they're like, I don't want to deal with people who are talking and they have needs and they ask for things. And this is kind of part of that dehumanization. Sometimes it can happen in healthcare. But anyways, so I always try to remember, and I teach my students when we go into the ICU. Right now, I'm actually teaching clinicals at St. Joe's. And we go in, and the best teacher is someone who mentors and someone who provides an example. Okay, it's not what you say. I could say things to Michael, I can do open heart surgery on you, you'll be fine. I could say all sorts of things, and that doesn't matter. What matters is what you show them. So I always go in and go, let's go take care of this patient. And I go in and I talk to the patient. They're like, you're talking to the patient. Of course I'm talking to the patient. They're a patient. They're in here, right? And they can hear you. They can hear you. And one story, it's kind of funny, but we had this very annoying nursing assistant. Let me just call him Earl, because that was his name. Anyway, so nobody could really stand. Earl was an annoying guy. He just was that guy. Nobody liked him. He just would come in and talk to you, and immediately you just don't want to be around him, okay? And the patients felt the same way about him. Please get Earl away from me. Anyways, so we had this patient on a ventilator for a long time. And one day she woke up, we got her off the ventilator. Okay, I'm not kidding, this actually happened. She woke up and she looked at the nurse and said, wherever Earl is, I don't want him ever in my room again. She said it with more swear words, like, keep effing Earl out of my room. That's what she said. I'm not kidding you. I'm not kidding you. I'm like, Earl, what are you doing? What are you doing? Can't you just not be yourself for 5 minutes? But he couldn't. Earl, it was not a good place for Earl, and I do think he found a better place for him. But my point is that he opened his flabber jabber and did enough things in that room that she heard it all. I'm like, you can't talk about it. This drives me nuts, healthcare people, right? The nurses are taking care of a patient on the ventilator, and they're like, oh my God. I don't know why I talk like a belly girl when I do my introductions. And they're turning the patient and them, oh my God, are you going to go out to that place tomorrow night? Did you talk to that guy? Did he ever text you back? And they're like doing peri care and they're flipping the patient. And I'm like, you do know that that's a human. They don't care to know about your loved ones. They don't care to know about your Tinder account or whatever you people are talking about. Can you please treat this like there's a human being? But I've heard some crazy things, and I have to sort of say, okay, guys, let's remember, because I think about Earl. I do. I think about Earl and I go, my gosh, you know. I don't know what they remember or what they don't remember, but they hear things, right? Don't they say that hearing is the last sense to go? And I just never wanted to be the person where they said, whoever that Mari chick is, please do not have her come in my room again. Like, I just didn't want that to ever be anyone to say that about me. So just remembering, once again, person-centered care, there is a human being in there, human being. So one of my favorite people, of course, in the whole world is Mother Teresa. And I did have an opportunity to have some interaction with her, while brief, back in my early nursing career. She was a patient, became a patient one night at my hospital. I worked in Scripps Green Hospital. And she was there in the United States. I don't know what she was doing, but I do remember working in my unit, and one of the nurses was going to go home because we were overstaffed. And then the nursing supervisor said, "No, Julie, you can't go home." And she goes, "Well, they just told me I could go home." "No, you have to admit a patient." "Can't somebody else admit the patient?" She goes, "You have to admit this patient." It was Mother Teresa. "You're going to admit Mother Teresa." And she's like, "Oh, and yes, I am." I wouldn't go home. I didn't get off, and I'm like, "Why don't I get to admit Mother Teresa?" I want to admit Mother Teresa. But anyway, she spent, I guess, she was in the ICU a little bit there. It got sketchy. She had some pulmonary problems, and they weren't sure she was going to make it, but she certainly did. But I will tell you that she just inspired every single doctor. I mean, we had Dr. Klein. Larry Klein is like, "And I am going to be volunteering for the children in the orphanage." I'm like, "No, you're not, Larry. We're all inspired by Mother Teresa, but I know you're probably not doing it." But you know, she was so good. Like, she could just be, you know, you're not going to do anything. So let's just not even pretend you're going to do anything. But you know, she would just talk to people. You know, "Oh, you're a nurse. You know what you do is the greatest." I mean, she just had everybody inspired. This little tiny woman with all of her shrouds and her little entourage of little tiny women and all of their shrouds. But you know, she just, what I mean is she was fantastic. And what a blessing to even be in the same building as Mother Teresa. As a matter of fact, we had celebrities who were trying to crash the building to come and see. Sylvester Stallone. Yes, apparently we had to kick him out. Security. He just decided, because he was Rocky. He was Rocky. He's going to come in and see Mother Teresa because I'm Sylvester Stallone. And they went, bye-bye. How to do that is be Julia Roberts also came. She met one of my friends, but she donated a whole bunch of money. So she did it the right way. She donated a whole bunch of money and then said, "May I please see the Mother Teresa?" Well, you gave us a couple million, so I'm yes for you, Julia, and no for you, Rocky. Right, listen. Yeah, okay, but I remember the day that she was discharged and Dr. Klein, I don't mind calling him that now because he is probably, but I just remember Dr. Klein, the other, you know, it's all the media, and there he is walking next to, he was the pulmonologist, you know, he's like, "Look, I saved Mother Teresa." Anyways, it was good times. So in this life, we cannot do great things. We can only do small things with great love. And that's really what I believe whenever I'm stepping into my arena, whether it's taking care of patients or nursing students. I always think, okay, you know, I'm just one person. You know, I never claim to be the smartest person, the best person, the most spiritual person. I'm none of that. But what I do have going for me is a great passion for whatever I do. And that's something that I believe in. Do something that you enjoy doing, that you can feel passion. You may not feel that passion every day, but I can honestly say with nursing, even when I went back to COVID, I just remember kind of so giddy and excited. I was like, "I'm going to take care of patients. This is going to be so much fun." It wasn't. But I thought, "This is going to be great." And they're like, all the ones that had been there for a while were looking at me like, okay. But you know what? It was so meaningful. All those moments that I could do something, even if the outcome was not great. And like I said, there were moments where I just was looking in someone's face and I thought, "You're the last face. I'm the last face you're ever going to see." I thought, "I'm going to be the last face. What do I want you to remember? I got to do something kind. I got to do something good." See all the pressure, once again, the pressure I put on myself. Because if I'm the last person they're going to see before they go into their deeply sedated coma. So talking a little bit, this is another quote, person-centered care. So there was an utter void created by the longing Interdictable, unremitting, pervasive for warmth of human contact, a warm smile, an outstretched hand were valued even above the offerings of modern science, but the later were far more accessible than the former. I became convinced that nothing a hospital could provide in the way of technological marvels was as helpful as an atmosphere of compassion. Right, so these are just the quotes that make me remember that, you know, we are a world of technology. Like I said, technology from 30 years ago, what my ICU patient looked like. Now I have my students at St. Joe's and they're like, well, this guy got an LVAD and RVAD, and he's on some ECMO, and then he's gonna get some dialysis, and then he's gonna, you know. They're hooked up to 25 different machines, and I'm like, okay, this is good. I hope they're gonna, I want them to make it, I hope they make it. And then they wake up and it's like, okay, well, what about the rest of the person now? Yes, that's great that we saved the physical body, but what's gonna happen to that soul? You know, you see all the trauma, right? The trauma that happens to a patient who's been in the ICU, the delirium, right? The delirium, Dr. Oh. And all of a sudden, it's kind of like, I feel like in medicine, I'm not blaming medicine, I'm not blaming nursing, I'm just saying, we feel like we did our job if we get you out of the ICU, right? Well, I got you out of the ICU. You're short a couple legs and you'll probably never walk or talk again, and you're gonna be fed by it too, but good luck to you. Godspeed, you know, and then we ship them off somewhere else.
Yes.
Which is why myself personally, I told my family, I know this can sound really dark, but I say to them, don't you ever trach me, hole in my neck, or peg me. No, I'm not going out like that. I don't care if I die, it's fine. And they just kind of look at me, you know, you figure probably at this point, they look at me and they go, okay, mom. And then my one daughter says, don't worry, we won't have any problems pulling the plug. I go, okay, well, let's talk about this for a second. I go, I understand what you're saying, but you sounded really kind of giddy. You sounded sort of thinking about that, like, I was gonna get ready. I go, don't worry, I'm spending all my money before I check out. So please don't incentivize to pull any gloves. I'm just saying that I know for myself personally, my spirit and what I want to do and be able to give to the world, if I can't give that, I really don't think I want to be dependent on other people. That's just a personal belief. I'm like, so please, let's not take it to the, but I have told my family, because I do see these conversations, these things happening, and then when I see our families going, well, I don't want to be the one to pull the plug on Aunt Mabel, and in my mind, I'm like, oh honey, Aunt Mabel's 96. She gonna be okay. She's ready. But if you don't have those conversations, people feel very guilty, right? Right? They feel very guilty. Oh, I don't want to be the one to make the decision. So don't tell your families, have your advance directives, right? So it's not you making the decision. They made the decision a long time ago. They made the decision. Okay, so best practices. So talking about collaboration. So I had my chaplain, Kevin. How am I doing on time? I'm doing good. You're doing good. So when I met chaplain Kevin, I remember that first day I met him, I met this glorious man. No, I'm not talking about like a handsome man. He's a nice man. But I met this glorious man in terms of just his presence. His presence was godly. He was there to serve. He just come, this humble man, hi Mari, how are things? You know, and I'd have my list of patients, I'd have my list. And I remember, I was like, oh my gosh, I have my, you know, he was for our own hospital. And I just would go through my list and I would go, 212. The wife is really struggling, you know, she's been here, she's crying a lot. I would go through my list and I would give him my list. And maybe it would be about the patient, maybe it would be by the family member. And I'm telling you what, he would see every single patient that I would say, I really think that they could use you, you know? And he was just magnificent. He was like, here's my cell phone, here's my whatever phone, I have to go run an errand, you know, but if you need me, call me. It was like I had my own personal chaplain for these patients. And I was like, well, I'm using this service. I am using this service. So I always made sure that I would round with my nurses and then I would personally round and I would say, how's the patient doing? Is there family? Sometimes people don't have family. And maybe they're not even saying, I'm sad, I'm depressed, I'm suicidal, but I go, you know what? Bob in there, you know, I know he lost his wife last year. And no one's to come visit him. This is maybe back when there were visitors. Could you go sit and talk with Bob for a while? I will do that. And he would go and see all the patients. And I'll never forget the day we had a patient. He had been kicked out of the sober living house for not being sober. And all of his belongings were left at the house, and he was a challenging personality, let's just say challenging personality. Someone doesn't really follow the medical advice. I think diabetic, brittle diabetic, doesn't take his medication. And he wasn't the most pleasant person, he's that kind of person that'll probably spit at you or kick you or, whatever. But I remember Kevin, and I was like, well, we got Bob here in room 7, he got kicked out of sober living, so I don't know what we're gonna do with him, but he wants his phone, he wants some of his things, and he has no way to get them. So he had no family, he had nobody. Like, basically, some people in life are basically, they have nothing. Okay, they don't have family, they don't have anything. And so I remember he came up to me and he says, so did Bob, and he goes, listen, I'm gonna go, he's like, I'm gonna go get his things. And I might get written up for it. He said something along the lines of, I might get in trouble for this, because I think there was a policy, you can't go to someone's, or whatever, it was like a policy, right? Policy, procedure, HR, legal. Anyways, don't break the policy. How many policies do you think I read? If they're dumb, I break them all. Anyway, so Chaplain Kevin came up to me, I'll just never forget it. He goes, I'm gonna get stuff. I guess if I get written up, I get written up. And I was like, Kevin, you're amazing. And I said, I'll tell you what, I'm not gonna dine you out. So if anybody, let's pretend we didn't have this conversation. I said, give me your cell phone. I'm like, you're not gonna run in and do CPR, but he was willing to get into trouble to go do something for a man that everybody else had written off. But everybody else says, you're worthless. You are not worth my time. And Kevin did it. And God bless him. God bless him. But that man worked tirelessly through COVID, tirelessly through COVID. And he was my favorite person to see every morning, for rounds. It sure wasn't Dr. Chatham, sure wasn't some of these other people. And they were fine, they were wonderful. But I mean, I knew that he was going to, when I talked to Kevin and we had this conversation, we were on the same page, right? I was like, we gotta see what we can do to help this, right? We gotta see what we can do. So being aware of implicit biases. So this is kind of why I brought up some other religions. I brought up other religions because sometimes in our world, we're human and we can have bias. That's very normal, right? It's very normal to have bias. So I always like to think of myself, I think, was it Dr. Younger talking about, somebody was talking about crossing a line, and if somebody asks you what your religion is, and, being very careful that we're not wanting to seem like I'm trying to push my religion on you. Here, let me pray for you. I always look at it like at the most basic level, you're human, I'm human. Let's talk as human to human, not Catholic to Muslim or Mormon to Christian or whatever. Why don't let's just clear all those. If you clear that out of the way, I'm a human the same way you're a human. When you approach someone like that, it's amazing how far you can get. Even for somebody that I'm like, listen, I've never lived your life. I don't know anything about being Indigenous, Native American. I don't know anything about your addiction problems, but sometimes just a kind gesture to say, you know what, I'm not here to judge you. I'm a human and you're a human. And that's how we can interact. I'm here for you. I'm not here to put what I think you need. It's not up to me to tell me this is what you need. You need me to pray for you. No, it's not about that. So being aware of bias, solid relationships between nurses and chaplains, or really anyone, and anyone even in here, folks that don't have to be a nurse, don't have to be a doctor, but you're a family member, you're a friend, and you come in and you notice that your friend, your loved one is distressed. You know what? Depending on where that person is, at my hospital, I could put in a spiritual care consult. That was in the chart. Spiritual care consult. You don't need a doctor to do that. You just click it in. You just put it in the computer, clickety-click, and you maybe write a little something like, found the patient, blah, 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 or whatever it is, because our spiritual care providers cannot help if they don't know. They cannot help if you don't know. And so we as nurses, I'll talk about me as a nurse, I am the eyes and the ears for the doctor. Okay? 100%. Doctors, they can't be there 24 hours a day. They're going to respond to what I tell them. They're going to respond to my assessment, what I notice as cues or clues. But there are often resources that you don't even realize as nurses that might be out there. Social work. Sometimes maybe it's not spiritual care. I've had patients who are like, I haven't come to the hospital, I have a dog. no one's there to take care of my dog. And I've actually been able to like say, okay, let me reach out to social work. If you got great social workers, you know what? I've had people, they found volunteers who are willing to go get their dog. Go get their dog for them. Because that was the most important thing to that patient. It wasn't whether he got his vancomycin trough drawn at exactly 30 minutes after the whatever. They don't care about that. It's funny. We care about these things, right? We care. We have to give you these meds and we have to get you down to CAT scan. And he's like, my dog's home alone. My dog's home alone. In fact, we have a scenario, right? So I have an educational scenario, a simulation scenario for our students where we have someone kind of pretend to be a patient and they're talking about their dog, Mr. Wiggles, and the nursing students, we see how they respond to this patient who doesn't care at all about his diabetes and his blood sugar. And we see what how our students respond to the patient's concerns. And then we debrief about it. Hey, it was great that you really thought about how that helped, you know, him with his problem with his dog. Or, you know, tell me more, you know, not why you ignore the patient, but sometimes patients say things that we don't really want to deal with, or we don't know how to deal with it. And what we do is we just ignore it, right? Yeah, I'll get to that later. We'll deal with that later. If it's foremost on their mind, you kind of got to deal with it now. Consider all patients, not just the ones who are in spiritual care. So we think about, obviously, end of life, death and dying is probably a normal trigger for a spiritual care consult, right? Oh, we just moved the patient was on, now they're placed on, now they don't call it necessarily, you can have a do not resuscitate, but it's literally called comfort measures. So that is when we're like, listen, we're done, we're not doing labs, we're not doing meds, we're going to put them on medication to make them comfortable. And so maybe that's going to sort of trigger a spiritual care consult, right? And that's appropriate. But you guys, what about all the other patients? Just because you're not dying doesn't mean you don't need God. Or not God, you know what I'm saying, not God. But don't need spiritual care. You know, another cue is distressed family members, very distressed family members. So I remember being in the ICU and we had this patient and he had some advanced cancer and he was not doing well, but his wife was really not doing well. And the way that she manifested it was anger. Right? So nothing that anybody did was right. Okay. She was very, like I said, she would just kind of complain about everything. Everything was wrong. And finally, somebody, it wasn't me, I don't think it was he was ever my patient, somebody thought, you know what, I'm gonna have spiritual care or pastoral care come and sit with me. Because we noticed she didn't have any other family that would come in. It was just her and her husband. And she just, when they finally got someone to come sit with her, they didn't come sit with her for like an hour. She needed support. She didn't have any support. Her husband was gonna die. She wasn't at any point of even being near acceptance of that. So she was in the stages of grief, denial, anger. She was stuck in anger. And I was like, I don't know what to do. We don't know what to do. But somebody finally thought spiritual care. And someone would come every day and sit with her. And just sit with her and be with her. And it made a huge difference. She stopped acting out at the nurses. She stopped, trying to schedule meetings with the unit manager. All of these different behaviors that just sort of exemplified her own spiritual distress. She just needed somebody to be there with her. So it's not always, like I said, just the dying patient that needs it. It could be anybody really at any time. And I know that I can't, do we have resources that everybody could get a spiritual care visit? Probably not. However, when I was in the hospital, my own sister-in-law called my church that I went to, and my pastor came to see me. I didn't even know that was a thing. He just walked into my room. I'm like, oh my gosh, it's Pastor Mike. And he's like, yeah, your sister-in-law Pam called us. So that's another great idea for my folks here who are lay people. If your friend, your family member does have a church that they're involved in, you know what? How wonderful to get a visit from somebody from your own parish. And you know what? And I wasn't on a deathbed, or I was doing just fine. It was just so lovely though to have him come, and he prayed with myself and my husband, and I just felt renewed. So that was really a beautiful thing. So just thinking about what are the resources out there. Chaplains should contact patients' personal chaplains. So if that's ever an option. This is from an article about chaplains talking about how to collaborate. And they said that it's nice to have a chaplain, call another chaplain if you're gonna, do a referral. And maybe sometimes, is that always possible? I don't know if it's always possible, but it's great to look into that. And once again, solid relationships between nurses and chaplains. The most important thing you can do as a nurse, as a family, as anybody, is introduce yourself. So when in the hospital, and I see a chaplain of any sort in the unit, I like to go introduce myself. I'm Mari. Hey, I'm Mari. I'm one of the nursing instructors. It's really nice to see you here. Because like I said, they're going to go where they know they're needed. But if they know who you are and that you are sort of on the lookout, I always kind of think I'm a bolo. I'm a spiritual bolo. Be on the lookout. Be on the lookout for people that have spiritual distress. So when my hospital pastors or, I always wanted them to know me and I want to know them. And I think sometimes we're not good at that in healthcare, where we all kind of work in a silo. Oh, physicians. Oh, God. Cardiology can't get along with renal because they want to order different things. People aren't talking to each other, right? It's like a dysfunctional marriage, right? Nobody's talking. Just read the chart. It's in the chart. Just read the chart. There's no substitute for someone saying, "Hey, how are you? My name is Mari. I'm going to be your nurse today." Like, there's no real substitute for that in technology. I'm sure AI is going to come around and say, we can AI that. We can AI that. In fact, I had a colleague I went to get my PhD with, Aaron. I called him AA Ron. AA Ron. I called him AA Ron, and he was a very nice man on the spectrum. On the spectrum, I only say that because he introduces himself that way. I have high functioning autism. All right, well, I've got low functioning anxiety. I don't know what you mean. So, I mean, I have high functioning anxiety. Nice to meet you. But anyways, he would try to convince me that the world of healthcare was going to be robots. He goes, Mari, we don't really need nurses. We don't need them because we're going to train these robots to go in and give the pills. I just go, hey, Ron. No. He was like a brother. He was like a brother from another mother. The brother you never wanted. But he would just have these crazy ideas, and I would just look at him and go, no. No to all of what you just said. But we love each other. Anyways, all right, so, okay, two of my favorite quotes. Be the change you wish to see in the world, Gandhi, and unless someone like you cares a whole lot, nothing's gonna get better. It's not. So I encourage everybody, as I encourage my students, I encourage my children, anybody that know that you have power. We all have power. As a nurse, I try to tell my nursing students, they're like, oh, well, no one's going to listen to me because I'm just a student. I go, don't ever say I'm just anything. In the hospital, I have said, well, I'm just the respiratory therapist. And I would say, don't ever say I am just anything. Okay, because you just devalued yourself. You just devalued yourself. I said, you are an expert in your field. So if you want to devalue yourself and say, I'm just this and nobody listens to me, nobody listens to me. If you want to be a victim, you can be a victim. I said, but you know what? I think I have a lot of power and a lot of pull, and I've been able to do some great things for people. Not every time is everything going to work out 100% the way I want it, but I do feel strongly, like in my life as a nurse and as a spiritual person and as someone who really champions spiritual care and pastoral care, that I'm trying to leave my crumbs behind and trying to leave that legacy. And I think that once again, if we fix the body and no one's ever fixed the spirit, you don't have a whole person. And that's just reality. So I'm really grateful that that Father Mike asked me to come here and speak. And I hope that I provided a perspective that might, be helpful. And I just think everybody just know that anybody can make a difference and anybody can ask a question. Anybody can go to a nurse and say, do you have spiritual care here? Could you put in a consult, or would you mind doing this? Anybody can ask a question. Nurses, it's not that hard. It only takes me 5 or 10 minutes to sit with someone and introduce myself to where I'm going to build some trust with them without my computer in front of me. So just know that you can be whatever kind of practitioner you want, you can be whatever kind of nurse you want. You make that choice every day. But I always think, what would I want? What would I want to walk in? Who would I want? How would I want them to behave? And that's how I try to behave. And that's how I'm trying to educate the future nurses.